Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the Healthy Living edition of KUAM News Extra. More than 500,000 women in the United States have hysterectomies every year because of complications that are caused by fibroids and endometriosis. There's some data to suggest that as many as 40% of American women 35 and older have uterine fibroids. Here to tell us more about trouble in the womb is Express Care's Dr. Jitka Lom. Thanks for joining us again. Let's start off by explaining what are fibroids.
Okay. Well, you have your uterus that's in your pelvis, which is basically a smooth muscle balloon, which can get very big when there's a baby inside, but most of the time it's the size of a small, of your palm or a small pear. And that is made up of muscle. There's also a lining in the inside of that, in the hollow of it, which is called the endometrium. It's sort of like the icing on the inside of that cake. Anyway, fibroids are smooth muscle tumors that occur within the wall of the uterus or of the womb. Basically, inside the muscle, something happens and some thickening occurs, and the muscle grows and grows and grows till it makes a lump. So it's basically a lumpy uterus or a lumpy womb. And for many women, they don't even know about it. They don't know that they even have that. But for others, they're experiencing discomfort or very heavy bleeding, heavy periods because of it.
And what causes it?
Well, it's a hormonally based problem. Basically, these tumors are estrogen dependent. If you have an imbalance in your hormones between the two main female hormones, estrogen and progesterone, there's too much estrogen in your body, that will stimulate those fibroids to grow. And they can grow quite rapidly, you know, expanding over a year or two to a quite large size.
And so what kind of complications would happen? You mentioned that, you know, most women don't know about it, but some will feel discomfort.
Yeah.
What happens?
If they're very small, like the lumps are maybe just the size of a small plum or a pear in there, it's going to be okay. But when these tumors get very big, like the size of even a watermelon, a small watermelon, wow, or big, huge grapefruit, that kind of size, it puts a lot of pressure on the pelvis, so that people might feel like they have some pressure down below. They can't empty their bladder fully. It feels heavy. Their periods are heavy. They might have some back pain with it, and discomfort with intercourse as well. So they can be symptomatic.
Why are fibroids more common in women who are in their 30s and 40s?
Well, that's when we develop the hormonal imbalances from lifestyle and from heredity and from our ovaries becoming a little bit tired as well as we get older through the stresses of life. So we develop an imbalance, and then those fibroids begin to grow. If you can wait it out, though, when you reach menopause and the hormones go down, the fibroids will shrink and go away all by themselves. So that's a question of timing.
Okay, now what is endometriosis?
Okay, so we talked about the uterus being like a smooth muscle balloon, and on the inside there's the lining, which is called the endometrium, like the icing on a cake, and every month the woman sheds that lining off. That's her period, and the following month it'll grow back. So that's called the endometrium, and that endometrium should just be inside the uterus, inside that womb. But in some women, little pieces of that travel outside. No one's exactly sure how, but maybe traveling out through the fallopian tubes. And so then you have little pieces of that type of icing implanted on your bowels, on your bladder, on other areas inside your stomach. So every month when you bleed, you're not just bleeding out, you're also bleeding internally into the inside of your abdominal wall. And that becomes very painful for women. So they'll have incredibly painful periods, awful cramps, back pain, and just a lot of pain.
So how, as a doctor, do you treat someone who has fibroids or endometriosis or both?
Right, so it depends a lot on how severe their symptoms are. Both problems are related to hormones. So sometimes if the woman can be on birth control pills to regulate her hormones, it will improve. Other times more serious treatments are required, even surgery, both for endometriosis when some big cysts can form, and for fibroids when they get really huge, surgery is necessary to take them out. But as much as possible, we try to get along with hormonal treatments.
Okay, thanks, Doc. We've got to take a quick time out, but your questions are coming up right after this.